When the power went out, the patient on the operating table was dying, and the doctors were confused about what to do in the dark. But night nurse Patricia White remained calm in the flashlight's glow because that darkness wasn't foreign to her. When the generator failed to kick in and Dr. Harris said, "We have to stop the operation," Patricia took the surgical instruments in her hands. "No, we won't stop," Patricia said determinedly, and in the next 45 minutes, everyone at the hospital would learn who Patricia White really was, because some people wear white coats but never become powerless. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments which city you're watching from today and hit that subscribe button. Patricia White was the perfect night nurse at Metropolitan Hospital. At 38, she had been working at the same hospital for 4 years, never receiving complaints, quietly doing her job. Patients loved her because she was compassionate and patient. Doctors trusted her because she remained cool-headed in every situation. "Patricia is our most reliable nurse," said Chief of Medicine Dr. Williams. "She never panics, stays controlled even in the most stressful situations." But Patricia's ability to stay controlled came from very different places than normal nursing training. Patricia's night shift routine was the same minute by minute. She would start her shift at 7 p.m., check patients, distribute medications, coordinate with doctors. But these checks were different from an ordinary nurse. She evaluated each patient's condition with military precision, detecting critical cases beforehand. Her colleagues noticed the depth of Patricia's medical knowledge. "Patricia, how do you know so much?" they would say. "Experience," Patricia would say briefly. She never went into detail, never talked about her past. Patricia's equipment was also different. Normal nurses carried stethoscopes, thermometers. But Patricia's bag contained military-grade medical supplies, emergency surgical instruments, advanced monitoring devices, equipment designed for field conditions. Patricia White's real story began 20 years ago. She had joined the Army at 18. But why? It wasn't family tradition. It wasn't economic necessity. It was something else. Patricia had lost her mother in a traffic accident when she was a child. Her mother had been taken to the hospital, but she lost her life on the operating table. Patricia was only 12 years old. That day she had promised herself, "I will save people, those like my mother. No failure will ever cause loss of life." When she joined the Army, she had turned to medical corps. But after basic medicine, she was selected for further advanced training. Combat Medic Training, the most challenging program. Army Combat Medic Training was a 16-week, extreme conditions medical intervention training. Patricia was one of the most successful graduates of this program. Patricia wasn't just learning medical intervention, field surgery, electricity-free operations, saving lives with limited resources, decision-making under high stress. Most importantly, team leadership and coordination. Patricia's combat medic training wasn't just basic intervention. Modern Army medics received advanced trauma surgery, battlefield medicine, and emergency leadership training. "A combat medic's job isn't just bandaging wounds," her instructor Sergeant Rodriguez would say. "You're the person making life and death decisions. Even without electricity, even without a doctor, you will save the patient." Patricia had embraced this philosophy, creating solutions in the absence of resources, leadership in critical moments, fighting technical obstacles. The hardest part of her training was electricity-free operations, surgery by flashlight, monitoring with battery-operated devices, maximum results with limited materials. Patricia had developed superior abilities in this area. Her first deployment was Afghanistan, medical support at remote outposts. Patricia's most difficult intervention was an appendix operation without electricity. The generator had been damaged in a bomb attack. Patricia had saved a life by flashlight. Her second deployment was Iraq, urban warfare medical support. Patricia had conducted the most complex operations during this period, in shelters under hospitals, without electricity, without doctors, surgeries. Her third deployment was special operations, special forces medical support, classified missions. For 15 years, Patricia had saved 89 critical cases, never losing any of them. But what really changed her was an operation on the Syrian border. an emergency field hospital she set up for a civilian family injured in an IED attack. Patricia had saved a family of 6 in 8 hours without electricity, but during that operation, she had risked losing a child. That night, crying in her tent, she thought about her mother. She had promised herself, "Now I will protect people in civilian life. I will always be ready." After receiving an honorable discharge in 2019, Patricia had transitioned to civilian life. She had used PTSD therapy, adjustment counseling, and career transition support. But Patricia's goal was clear. Her experience on battlefields had directed her to protect people in civilian life. She wanted to prevent the kind of accidents that had taken her mother. Hospital nursing had been a perfect choice. It reminded her why she had chosen the medical field, but more importantly, it allowed her to be in the necessary position to be ready for medical emergencies in civilian life. When Metropolitan Hospital hired her, Patricia was overqualified. Nursing degree, 15 years of military medical experience, combat medic certification. But the hiring committee hadn't asked detailed questions. "I've always loved saving people," Patricia had said, and this time she was truly sincere. Patricia's duties at the hospital seemed simple: patient care, medication distribution, doctor assistance. But Patricia was doing much more. She evaluated every patient with combat medic eyes. She detected critical symptoms early. She identified potential emergencies beforehand. "Patricia, how do you evaluate patients so well?" her colleague Lisa would ask. "Observation," Patricia would say. "A patient's body language tells a lot." This observation came from 15 years of battlefield medicine training. Combat medics made critical decisions with limited time and resources. Quick diagnosis, proper intervention, team coordination were basic skills. Patricia also knew the hospital's emergency systems very well: generator location, emergency power sources, backup equipment, alternative procedures. She had a complete emergency map of the hospital in her mind. Saturday evening, December 15th, a busy night shift had begun at Metropolitan Hospital. Due to winter storms, traffic accidents had increased and multiple casualties were coming to the emergency department. Patricia was assigned to the main surgical department supporting surgical teams. At 11 p.m., 5 seriously injured patients were brought from a major traffic accident. The most critical case was 8-year-old Emma Thompson. Internal bleeding, multiple trauma, emergency surgery required. Dr. Harris began the operation. Patricia was providing support as an assistant. Emma's condition was very serious. At 12:30 a.m., while the operation was at a critical stage, a citywide power outage occurred. The hospital was immediately plunged into darkness. "Generator will kick in 30 seconds, said the maintenance technician over the radio. But 30 seconds passed. The generator didn't work. Emergency lights were on in the operating room, but they would only last 10 minutes. Dr. Harris turned on his flashlight. "Patricia, find out the generator status." Patricia connected to the radio. "Maintenance team, what's the generator status?" "Generator's malfunctioning, waiting for information from the electric company. Repair time uncertain." Dr. Harris began to panic. "Emma's operation is half finished. We can't continue under these conditions." Patricia looked at Emma. The 8-year-old girl was fighting for her life, just like her mother years ago. "We have to stop the operation," Dr. Harris said. "It's too risky under these conditions." At that moment, Patricia made a decision. 15 years of combat medic training kicked in. "No," Patricia said determinedly. "We won't stop." Dr. Harris was surprised. "Patricia, this is impossible without electricity." "I'm continuing," Patricia said, taking the surgical instruments in her hands. Patricia moved to the head of the operating table. She evaluated Emma's condition in the flashlight's glow. "Dr. Harris, support from the left side. Nurse Adams, prepare blood packets manually. Technician Johnson, bring battery monitors." Everyone was surprised by Patricia's commanding tone. This was a Patricia they had never seen. "Patricia, you're a nurse," Dr. Harris said. "I'm the lead surgeon." "Dr. Harris," Patricia said calmly but determinedly, "I know how to operate in the dark. Do you?" Dr. Harris fell silent. Patricia took the Elliott forceps in her hand. After 15 years, she was operating under field conditions again, but this time it was on an operating room floor, not desert sand. Internal bleeding continues, Patricia said. Splenic artery control needed. Patricia's combat medic training kicked in. Precise work by flashlight, vital signs with battery monitors, respiratory support with manual ventilation. Nurse Adams, manual blood pressure monitoring. Dr. Harris, retraction and visualization support. Patricia's hands worked like precision instruments. Even in darkness, every movement was calculated. "How is this possible?" whispered Nurse Adams. Patricia didn't answer. In her mind, that emergency operation in Afghanistan came alive. The generator had been damaged by a bomb. There was no electricity. Patricia had performed an appendix operation. "Splenic repair completed," Patricia said. "Now, internal bleeding control." Dr. Harris was just watching. Patricia's skill was incredible. While Patricia was conducting the operation, she was also coordinating the entire team. Johnson, battery level check. Adams, blood availability status. Harris, visual field optimization. This came from combat medic training in the Army. Team leadership under extreme conditions, resource management, critical decision-making. "Patricia," Dr. Harris said, "you've done this before." "Yes," Patricia said while focusing on the surgery, "under much more difficult conditions." Emma's vital signs began to stabilize. Patricia's intervention was successful. 45 minutes later, the power came back. The hospital regained its normal lighting, but the operation was already completed. Patricia was doing the final sutures. Emma's condition was stable. The operation was successful. Dr. Harris looked at Patricia. "This was an incredible performance." Patricia removed her gloves. "It was just necessary." "No, Patricia," Dr. Harris said. "This wasn't normal nurse performance. You're a surgeon." Patricia hesitated. It was time to break 4 years of secrecy. After the operation, Doctor, Harris wanted to talk with Patricia. "Patricia, can I learn about your real background?" Patricia was silent for a long time. Then she began to speak. "I served 15 years in the United States Army. I was a combat medic specialist, 3 tours of duty, Afghanistan, Iraq, classified operations." Dr. Harris couldn't believe it. "You're a military doctor?" "Combat medic, advanced trauma surgery under battlefield conditions, electricity-free operations, life-saving procedures with limited resources." "Why did you never mention this?" "Because it wasn't necessary. I'm a nurse now." "Where did you learn these skills?" 16-week Army combat medic training, field surgery, emergency leadership, resource management, but most importantly, ensuring that no technical obstacle causes loss of life. Dr. Harris, why did you take the risk today? Patricia looked at Emma's sleeping bed. There was an 8-year-old child. I couldn't let her die due to technical failure like my mother. When the morning shift began, Patricia's story had spread throughout the hospital. Chief of Medicine Dr. Williams held an urgent meeting with Patricia. "Patricia, your performance last night was extraordinary." "Thank you, Dr. Williams. But I need to get information about your real identity." Patricia explained her situation. 15 years of military medical experience, combat surgery expertise, battlefield leadership. Dr. Williams was amazed. "Why are you working as a nurse?" "Because I want to serve people in civilian life. Rank and title don't matter." "Patricia, you're our hospital's most valuable asset. Would you manage the advanced trauma surgery department?" Patricia hesitated. "I prefer to stay in patient care." When Emma's family learned about Patricia's story, they came to the hospital. "Ms. White," said Emma's mother, Mrs. Thompson, "I don't know how to thank you for saving Emma." "I just did my job," Patricia said. "No," said Emma's father. "The doctor told us. Under normal conditions, our risk of losing Emma was very high. Your expertise saved her." When Emma woke up and saw Patricia, "Are you the nurse who saved me?" "Yes, Emma. How do you feel?" "Very good. Mom, this nurse is very strong." Patricia smiled. "You're very strong too, Emma." Patricia's story also caught the attention of other hospitals. she began giving emergency medical intervention training. Medical emergencies aren't just about equipment, she would say in her training sessions. Improvisation, adaptation, alternative solutions. Most importantly, never give up. But you're a combat medic. We don't have such training. Combat medicine teaches you adaptability, life-saving solutions under any conditions. The same principles apply in civilian medicine. Patricia's training program: electricity-free emergency intervention, surgery with limited resources, emergency leadership team coordination, crisis management. Patricia's electricity-free operation technique received great interest in the medical world. She received a consultancy offer from WHO. "Ms. White, we need your disaster medicine expertise." Patricia hesitated. "I'm in civilian life now." "We know, but your field experience is unique. Help us develop medical response protocols for humanitarian crises." Patricia accepted, but she had a condition: to always continue staying in patient care. Patricia now gave training not only at Metropolitan Hospital, but also at international emergency medicine conferences. She gave the same message in every training. Technical limitations don't prevent life-saving. Human expertise and determination always find solutions. Patricia's developed disaster medicine protocols became world standards. "When electricity goes out, medical care doesn't stop," she would say in every training. "We adapt." Patricia was still working the same night shift at Metropolitan Hospital. Emma had completely recovered and was growing up as a normal child. Patricia's greatest achievement was the sense of confidence she gave to hospital staff. "As long as Patricia is here, we can handle any crisis," Dr. Harris would say. One day, Hospital Director Johnson asked Patricia, "Patricia, do you ever regret it? Leaving your big military career?" Patricia watched the night shift nurses. They were caring for their patients, comforting families, saving lives. "No, Johnson, I protected soldiers for 15 years. Now I protect civilians." "The same mission?" Patricia pointed to the patients. "Yes, life-saving mission never ends. Only the location changes." That night, as her shift ended, she looked into Emma's room. The little girl was sleeping, safe, and Patricia would protect her. Her uniform might be a white nurse's apron, but her heart still beat with the same mission. Patricia's story isn't just a heroism story. It's also a story of how expertise finds meaning in civilian life, the instinct to serve, and never giving up. Because sometimes the greatest warriors walk hospital corridors to save lives. So I ask you, have you ever wondered about the stories of people who serve silently in the hospitals you visit? Do you know the hidden experts waiting to protect your health? Share in the comments. Because here at Hidden Legends, we believe that real lifesavers can be found in the most healing places. If this story touched you, share it, subscribe, and help these important stories continue. We'll see you in the next legend. And remember, the nurse at the next hospital you visit might have skills you never knew about. Real healers change their uniforms, but never their missions.